Let's uncover the dark mysteries of COVID vaccines, the creation, ingredients, and the business that has been working since 2018, 2019. But we, as common people, we didn't get to know about the entire situation. So, without any ado, welcome back to our channel. Here we delve into the mysteries and untold stories of our time. Today we are unveiling the dark mysteries of COVID vaccines, how they have been created, what's inside them, and how did they become a lucrative business. Stick with us as we explore the good, the bad, and the future it holds. The race to create a COVID-19 vaccine began in the virus spread globally in 2020. Scientists around the world worked at unprecedented speeds. Traditionally, vaccines developed in years. The development can take even decades, but COVID-19 vaccines were developed in just a matter of months. But how was this possible even? The researchers used mRNA technology, a method that has been studied for years but never used in widely distributed vaccines. Companies like Pfizer and Moderna used this technology to speed up the process. By decoding the virus's genetic material, they could instruct cells to produce a protein that triggers an immune system. This responsive system can help you protect. But this rapid development certainly raised some questions. How could they ensure safely that effectiveness in such a short time? The answer lies in the overlapping phases of clinical trials and massive funding from governments and private sectors. Of course, everybody were dying. COVID was enormous. It was a total lockdown situation. Nobody was going out of their home. So, of course, private and government funded all together. What exactly is inside these vaccines? Let's break down. Then only we can understand how it works. The main components are: number 1, mRNA, the genetic material that provides instructions for our cells to make spike protein found on the surface of the viruses. Number 2, lipids, these fatty molecules encase the mRNA, protecting it and helping it to enter the cells. And lastly, salt and sugars. These help maintain the stability of the vaccine. So these three things are the essentials for this entire vaccine. Okay. Other vaccines like AstraZeneca and Johnson & Johnson uses a viral sector approach, which involves a harmless virus to deliver the genetic code to spike the protein. But the demand was enormous. It skyrocketed, and government sorted out this problem and reopening economics. Companies like Pfizer, Moderna, and Astra, they all received billions in pre-orders, securing their profits even before their vaccines were approved. Can you imagine pre-ordering vaccines without even getting approved from FDA and whatnot? While many have profited, this also led to concern about accessibility, especially for lower income countries. Wealthy nations were able to secure large quantities of doses, of course, but the poor countries were left behind. Let's talk about the scales. On one hand, vaccines have been a crucial tool to combat the COVID-19. They have drastically reduced severe illness, hospitalizations, and death. Side effects were generally mild, included pain, fatigue, and mild fever. However, there have been some reports of rare but serious cases such as myocarditis in younger people, blood clots in certain vaccines, and death also happened. These risks were also accompanied with again having COVID-19 tested positive after the vaccinations also. Especially for the Covishield people, nowadays they are dying out of whatnot. The virus is like to become endemic, meaning it will circulate in the population at lower levels. What next for COVID-19 and vaccines? The virus is likely to become endemic. Meanwhile, in circulating of the population at lower levels, annually a periodic booster shot may be very routine in life, similar as flu vaccine. Researchers have also working on the next generation of vaccines that could provide broader protections and long-lasting immunity. That means you get a vaccine booster and you don't need to take booster for a long time. So, the story of COVID-19 is still unfolding. As we move forward, it's essential to remain very informed and vigilant. Okay. So thank you for joining us on this journey where we as a team discovered that it is not only the vaccines, but it's a business model where it almost worked in some places and it doesn't work in some places. Some people died of it, some people got saved just because of these vaccines. I don't know about the FDA approval and everything else, but I think these vaccines must be tested on regular basis and modify, and the scientists must take a very, very precautious way to rebuild from the scratch, because next time a pandemic hits, I don't think this will save us. The booster doses were just almost felt like gimmick. It didn't work. Some people got extra illness which were there, like they had it beforehand. Some were little sick, they got heavily sick. So I request everybody to stay vigilant and protect yourself and always ask questions, because if we are not asking as general people, as general normal human being, if we are not asking questions, then so yeah, thank you very, very much